Welcome to the Ask Dr. Khan show, where you're just one whiteboard away from solving your health puzzle. I'm Dr. Peter Khan, functional medicine practitioner, and this is a continuation of our Neurotransmitter Video Series. And today we're going to be talking about acetylcholine. Now, acetylcholine, you may not have heard too much about, but it's a very important neurotransmitter that's involved in memory, for you to store short-term and long-term memory, cognition, learning, and muscle contraction. So acetylcholine is very, very important. So we're going to talk about some of the symptoms, where it's made, how it's made, and where things can be broken. Now, if you have problem with acetylcholine, meaning you don't make enough of this neurotransmitter, then some of the symptoms will be, obviously, as it deals with memory, you're going to have a decrease in visual memory. Visual memory means that you don't remember shapes or images. Well, that turns out to be critical in helping you to not get lost. You see, for you to recognize when you go down the street, you know, which way to turn, which a lot of times is the recognition of landmarks. Oh, there's a tree there, and there's a street sign there, and there's a store there that I recognize. If you start to lose visual memory, then you're going to have trouble finding your way back. You can get lost. And that's why people with Alzheimer's disease, they have problem in the temporal lobe, and temporal lobe is the area of the brain where Alzheimer's disease primarily happens, meaning that part of the brain is damaged or losing brain cells. That's why you can't remember things, you start to get lost. And acetylcholine is the primary neurotransmitter used in the temporal lobe to help with these functions. That's how they're connected. So that's why when you have acetylcholine deficiency, many times we're going to see these memory problems. You can also have decrease in verbal memory, where you kind of just can't get the words out, you forget what words you want to use. You can have memory lapses where you put things, 2 minutes later, you go back, you forgot where you put them. You walk into a room, you forgot why you walk in there in the first place. These are all very common, but remember, when you have these symptoms, it's not getting old. See, there are people who are older than you that have crappier memory than you do, and the people who are younger than you that have worse memory than you do. I'm sorry, the other way around. People who are older than you that have better memory than you do, and people who are younger who have worse memory. So what that means is age is not a determining factor, but how old is your brain? Not the age in its years, but how much damage has there been. If you abuse alcohol, have a lot of head trauma, and your blood sugar stings, you're inflamed, that's gonna make your brain age a lot faster, even at a young age, compared to someone who's relatively healthy, eat their vegetables, they exercise, they have keep the stress to a minimum. These people, even into their old age, can have really good functioning brain. I'm just looking at Warren Buffett. He's pushing 90 and he's still very clear. So age is not so don't ever let that fool you. Don't say I'm just getting old. That's BS. Oh, you're 30, you're 40, I'm 50, I'm expecting memory loss. That's BS. Do not expect that. You should expect optimal health. The problem is Western medicine's got you brainwashed into thinking that we're all sick and you need a drug to keep you healthy. Drugs don't keep you healthy. Drugs are there to treat symptoms, and there's a time and place to treat symptoms. But don't make no mistake about it. Medications do not make you healthy. Medication is not health care, it's disease care. To get healthy, you gotta actually fix the root cause. It's always up to you. You gotta take personal responsibility. Okay? Now, other symptoms, let's talk about decrease in visual memory, decrease in verbal memory, memory lapses. Okay, these are some of the symptoms of acetylcholine deficiency, which is related to a temporal lobe dysfunction. You can also have decrease in creativity and learning, because the acetylcholine helps with cognition and learning. Part of learning is have memory, right? You can also have decrease in comprehension, part of that learning process. You can't comprehend if you can't just put it all together. That's where cognition comes in. Also, when you have decreased acetylcholine function, you can have decreased ability for calculating numbers. So maybe you used to be able to do arithmetic in your head, and now it's very difficult. You always have to use the phone. That could be just digital dementia, because you just become so reliant on cell phones, you don't use your brain that much. But definitely, if there's a rapid decrease in your ability to do the things that you used to be able to do, you need to consider the fact that there may be some deficiency of this neurotransmitter or a degeneration of the temporal lobe. You can also have slow mental recall. You can have difficulty recognizing, you can't recognize faces, right? That's when it gets scary. You know, you look at someone and he's like, you know, it looks familiar, I don't remember who he is, or you just don't remember, and now in late stage Alzheimer's, that's when you start not recognizing your family member. And that's very, you know, sad, and that's not once the problem with Alzheimer's is that once you have neurodegeneration into that late stage, it's not really reversible. It's a progressive condition, meaning it gets worse and worse. You can't really reverse it. You can only hope to slow it down. So you're not trying to get there, right? There's 7 stages of Alzheimer's disease. By the time you hit stage 4, it's already too late. So we're trying to intervene at early stages, stage 3 and so forth. Okay, so we can look at that, and there's a lot of strategies to support brain function. And we've been talking about it all along. All the videos are pieces of the puzzle. All these, as Dr. Khan showed, the whiteboard presentation, are a piece of the puzzle. So the more video you watch, the more you're able to fill in the pieces and start to help yourself. Find better solutions, find natural solutions, and work with someone that can guide you through that process, okay? Now let's talk about where acetylcholine is made. So where it's made. So it's made both in the brain and the body. There's a blood-brain barrier, and these neurotransmitters do not cross the blood-brain barrier because they're too large. So what's made in the body cannot cross into the brain. What's made in the brain stays in the brain, kind of like Vegas, okay? So your brain is made in a whole bunch of different areas. I don't want to bore you. It's made in the pedunculo-pontine region, like in the brainstem. It's made in the lateral dorsal tegmental area in your mesencephalon. It's made in the nucleus basalis of Maynard. It's like a region in your brainstem. It's also made in the medial septal nucleus, which is kind of like midline region. So it's made in various parts of the brain, and it has projections and tracts to deliver those neurotransmitters, acetylcholine, that are made in those spots to deliver to the rest of the brain, okay? So that's just, it's produced in the brain. And what's made in the brain stays in the brain, and it's used in the brain. Now in the body, acetylcholine is very important. It's actually primarily used and made in the autonomic nervous system. So this helps with autonomic function, things that are on autopilot, like heart contraction, like blood pressure, like heart rate, like, you know, sweating and gland secretions. The gland secretion, like for you to sweat, the sweat glands, they have to contract for the sweat to come out. That contraction of the sweat gland, that muscular contraction is controlled by acetylcholine, a neurotransmitter, to affect that autonomic nervous system. So it's really important for your bodily function, vital function. Not only autonomic, or things that are on, you know, autopilot, like smooth muscle and cardiac muscle, it also controls skeletal muscle contraction. Very important in muscle movement, okay? It also is made in the enteric nervous system, which is the nervous system in your gut, or called the second brain, right? You actually have more neurons in the enteric nervous system than in your brain. That's just how important your gut nervous system is, because these nerve cells have to innervate the gut to get the gut to contract, to sense what's in the gut, to help with secretions. And so this helps with intestinal motility. So you can move your bowel. So you can have bowel movement, right? So if you're constipated, consider maybe acetylcholine deficiency in the enteric nervous system, or consider neurodegeneration of the enteric nervous system. Just like the brain can degenerate, like causing Alzheimer's disease, your gut nervous system can degenerate and lead to chronic constipation. So that's really important. And also, it's also made in the dorsal root ganglion. and this is a collection of neurons in your spinal cord, and this helps with nerve transmission. Okay, so these are where it's made in the body, and it stays in the body. It's used locally here, and what's made in the brain stays in the brain. Now let's talk about how they're made. Okay, how it's made. I want to cross over here because we're running out of space. All right, so here's the fun part. It's made, how it's made in the brain, and here's the blood-brain barrier, and how it's made in the body. So the synthesis, how your body produces it, starts with food. So food, high in choline. Okay? Because acetylcholine is made of an acetyl group and a choline group. So you need choline. Well, guess what foods are high in choline? Egg yolks are high in choline. Your fatty meats are high in choline. Nuts, tofu can be high in choline. And even your milk or cream, you know, basically your fatty foods. Now I'm talking about good fats, right? Not like Lay's Dorito chip fat. We're talking about good healthy fats. So these choline, when you eat it, you have to absorb it. And that absorption depends on things that help you break down fat. What are the things that help you break down fat? Well, lipase, which is an enzyme produced by your pancreas, but really bile is really important, right? And that's produced by the gallbladder. I should go the other way. Gallbladder produce bile, and the bile help you absorb these cholines. So if you have gallbladder dysfunction, or you don't have a gallbladder at all because it's been surgically removed, you're going to be behind the 8 ball. You're going to have a difficult time absorbing these nutrients. So now once these choline is absorbed, choline readily crosses the blood-brain barrier. It crosses really easily, okay? It's a compound that just crosses. And once it crosses the brain, what your body does, it has to combine it with an acetyl group. Okay, so here's brain. Maybe we should kind of create a separation of space here so we know what we're talking about. So here we have glucose. That darn blood sugar metabolism again. Gosh, these neurotransmitters just won't leave the glucose, or the glucose just won't leave the neurotransmitters alone. See, when people have these memory lapses, you know, they're given supplements or drug to try to increase acetylcholine level in the brain. But if you have a blood sugar imbalance, you can't even make this stuff because glucose gets converted in the brain into an acetyl group. An acetyl group combines with the choline that you get from food, which crosses the blood-brain barrier, Then you get acetylcholine. That's where it comes from. So you need proper blood sugar level and you need choline. Now, guess what? In addition to dietary sources, your brain also can make its own choline. It can actually get choline on its own. So endogenous sources of choline is phosphatidylserine. Your body can break that down into choline, okay? And then you have phosphatidylethanolamin, which your body can also break down into choline. And then if you don't have enough choline from your diet, let's just say you're vegetarian and you don't eat eggs, you don't really like too much nuts because you have nut allergy, so now you're just like, you're not really getting too much. And then you have a gallbladder that's been removed, you just don't digest food well, you can be really deficient in choline. You can get in a little trouble here. So what your body does, it can actually break down your own brain cell. We don't want that, but that's just what happens. Break down cell membrane of neurons to get the choline. Oh my gosh. So body will catabolize healthy tissue, break down the cell membrane of your neuron to get the phospholipid, which is the cell membrane, phospholipid bilayer, to get the choline from that to supply the choline. So your body is smart, right? It's just trying to compensate because you're not getting enough or you can't absorb enough. So your body can use brain nutrients like phosphatidylserine, which you can take in a supplement actually. and then you can break down neuron cell membrane to get the choline. Once you get the choline, then it's going to be combined with acetyl group to form acetylcholine. That's how you get this stuff to help you with memory, cognition, learning, and muscle contraction, and helping with autonomic nervous system function, helping with heart contraction, all this vital life function. You need this stuff, and it's all nutrient driven. So check this out. For you to make this choline, for you to make this acetylcholine, there's an enzyme here that's needed, and this enzyme is called choline. What's it called? It's called the choline acetyltransferase. Okay. Now this enzyme is B5 dependent. You need vitamin B5. So there's a cofactor here. You need a nutrient to run this enzyme to combine these into acetylcholine. Okay. And then once you have that acetylcholine, remember, just because you have the neurotransmitter is not enough. You need to get it into the cell, into the synaptic cleft, I should say, right? Because that neurotransmission happens in the synaptic cleft, and there's receptor there, so the acetylcholine got to dock onto the receptor, and then receptor, there's two different types. Acetylcholine is very unique this way. It has a muscarinic receptor, and it has a nicotinic receptor. The muscarinic is primarily more in the brain. It's also found in the body as well. I don't want to make it like so exclusive. And it's also in the heart, but primarily in the brain. And the nicotinic receptor primarily in the muscle, but it's also found in the brain too. So they're both found in both places, but you're going to see muscarinic more in the brain, nicotinic more in the muscle. So what that means is there's certain diseases that can affect certain receptors here, and I'll talk about that in just a little bit. And there's certain drugs that affect these receptors differently to help get a certain desired effect from the medication, okay? Now, as always, once the acetylcholine docks onto the receptor and does its job, which is transmit neural messages to do what you're supposed to do here, then it has to break it down. Neurotransmitter can't just hang around forever. Your body got to break it down and recycle it. And that breakdown is done by this enzyme called the acetylcholine esterase. Acetylcholine esterase. And there's medications that can block that, or agonists or antagonists that will either promote it or block it. Okay? So that'll break down into this final product, which is acetate and choline. And that's the complete synthesis and metabolism breakdown of acetylcholine. So let me show you where things can go wrong here. Things can bust with this whole pathway if you just don't eat enough foods high in choline. You don't eat eggs ever, and you're vegetarian, and you don't eat any nuts because you're allergic to it. You don't eat soy because you heard soy is all GMO. So then you're eating nothing that has choline in it. It's a problem. And then if your gallbladder's not working great, or you just don't have a gallbladder at all, or you don't make enough pancreatic lipase, then you don't digest the fat, then you don't get enough choline. Problem. And then it crosses the blood-brain barrier. Thank goodness it crosses easily. But if you don't have enough choline, your body will break down the cell membrane of your own brain to get that choline. So then you're losing neurons. Not good. And then, so we can have this right here, break down the cellular neurons. You can have gallbladder issue. You can have lipase issue, right? And then here, you gotta have proper blood sugar metabolism. So if you have low blood sugar, or you have insulin resistance or high blood sugar, or your blood sugar is up and down like a roller coaster, or you're already diabetic, none of that will help you make this stuff. It'll make it difficult for you to make acetylcholine. And then so you don't get enough of it, and so you don't have enough for bodily function. Now you can also have a B5 deficiency, although that's very rare. B5 is very commonly found in food, so not very many people have pantothenic acid deficiency. That doesn't really happen. Here at the receptor level, you can have receptor problem. How would you have that? Autoimmune disease again. So an autoimmune disease that attack the receptor is called myasthenia gravis. Really what I shouldn't say attacks the acetylcholine receptor, it attacks the neuromuscular junction in your muscle where that nerve transmission happened. So then you have this autoimmune disease that's affecting your muscle contraction. So people with myasthenia gravis will have muscle weakness and fatigue, typically like your eye, facial muscle, more proximal upper extremity muscles, but can be throughout the body. So myasthenia gravis is an autoimmune disease affecting neuromuscular junction, causing muscular fatigue, and it's an autoimmune disease. So that can be a problem there. And then as far as the breakdown, not much there, except on the receptor, by the way, hormones can impact that. So testosterone can sensitize the receptor, and estrogen can sensitize receptor. Testosterone will impact males more, estrogen will impact females in sensitizing the receptor of acetylcholine and make them more sensitive so that you can use more of what you got, okay? So that's where things happen. So these are places, the red arrows, where things break down. So again, in a functional medicine approach, when we're dealing with somebody with memory issue, we're always asking the question why. These are some of the reasons why, but I'm gonna tell you more important than that, I want to make a quick mention here of hippocampus. Okay? The hippocampus area of your temporal lobe, this is an area in the temporal lobe that specifically deals with memory and circadian rhythm. Circadian with a C, okay? So this area has loads of receptors for cortisol. Why? Because cortisol and melatonin play this dance that control the circadian rhythm. So in the morning, your cortisol level should be high, and at nighttime, your cortisol level should be low. That's part of your circadian rhythm. So your hippocampus actually controls that circadian rhythm, so it has a lot of receptor for cortisol to help with coordination of that daytime, nighttime sleep-wake activity. So what is the implication of that? If you have high cortisol, too much. Why would you have too much? Stress, blood sugar imbalance, inflammation, infection, pain, trauma or injury. These are all things that can drive a high cortisol response, meaning your body's gonna make too much. And too much cortisol will overwhelm the hippocampus because it's getting overstimulated by cortisol because it has a receptor for cortisol. So now you're gonna have hippocampus degeneration, where these cells in the temporal lobe will start to die off at a faster rate, right? Before it's time. That's accelerated brain degeneration or neurodegeneration. That's when you start to get memory problem, early Alzheimer's disease, like in your 40s, which is very abnormal. And people say, oh, just because you're getting old, complete BS. It's because you got these problems. I mean, you can be old and have these problems. You can be young and have these problems. Try not to have these problems. Work with us. Let us help you to manage and assess and identify and get rid of these problems so you can protect your brain. Y'all, protect your brain. And this can also not only cause memory problem due to this early Alzheimer push, it also cause sleep-wake disruption. So you can't fall asleep, can't stay asleep. So this is why acetylcholine support can be really important by identifying the root cause. There's certainly certain nutrients, B5 is a cofactor, but certainly there's other things that we can use. Huperzine, for example, alpha-ketoglutarate. So there's different things that we can use. The point is it's not about the pill or the supplement. It's about the root cause. Is it because of the cortisol issue? Is it because you have infection, inflammation driving the cortisol? Is it because you have autoimmunity? Is it because you have blood sugar imbalance? Is it because you don't eat the right foods? Is it because you can't absorb the food? Find that out. Have us help you, and you're well on your way to living a great, healthy life. And you're going to start to understand how you got there. And that's probably more valuable than just getting there, is understanding how you get there so you can manage yourself and help yourself to stay healthy for the rest of your life. So we consult with clients throughout the United States through video consultation. If you'd like us to help you follow through this process, all the other videos we talked about. This is a clinical roadmap that I've developed to help people with chronic health condition. We can help you. Let's have a discussion. Schedule a discovery call by calling 480-988-6269 or email info@askdrkhan.com. And you can also visit our website at askdrkhan.com, where you can click to schedule a discovery call, where we can help you identify or help you to let you know if you're a good candidate for our program and how our program actually works. Again, as always, please share and like this video. Put questions in the comment section. I answer every question myself. And please let as many people see this and hear this as possible. It'll change the face of healthcare. It'll change the quality of life of those who you love. And I'm Dr. Khan. I look forward to seeing you next week at the Ask Dr. Khan show. Take care.